It is no surprise the healthcare industry is facing significant struggles, leading to dozens of hospital closures, particularly in rural areas. And as Jennifer Hoff reports, a new study from the University of Minnesota now shows how much more you'll have to pay for care, at the surviving hospitals nearby.
Healthcare across the country has long had problems the pandemic only highlighted, from high costs to staffing shortages, even forcing some hospitals to close. 16 in rural Minnesota alone since 2010, according to the Department of Health. And now new research finds not only does that limit access to care, but drives up prices at nearby hospitals.
They will pay more at the point of service to go to the hospital. So that's important because it hits people's pocketbooks directly.
U of M Professor Caitlin Carroll studies economics at the School of Public Health and found after a hospital closes, people will pay about $500 more at the ones that are still open, essentially giving those hospitals more leverage to negotiate with insurance companies and eliminate any lower price options.
I mean, what variables or data are you using to get those higher price points?
We use commercial claims data from the Healthcare Cost Institute. So these are claims from folks who have private insurance that they get through their job. We as researchers have access to a large database of those claims that we can use to measure the prices people are paying for the care they receive.
Carroll tracked prices at more than 160 hospitals for 10 years and says premiums will also likely increase. But even when hospitals have to close, there are long-lasting consequences.
All communities need access to some hospital care, even if they don't have access to a traditional full-service hospital.
Jennifer Hoff, KARE 11 News.
Now, there are new laws that make hospitals post prices, but websites can be hard to navigate, and often people just don't have the time to research if there's an emergency.